Are you one of those people who says, oh, my aching back? Maybe yours does ache if you're like about 80% of the population. Well, renowned mind-body researcher Dr. John Sarno is in today to bring us a back pain sufferer and also his revolutionary diagnosis for chronic pain. It's called TMS, no drugs, no surgery, fast and usually permanent relief. Dr. Sarno has some remarkable stories for us. Also, Sara Vogeler is in with another method for relief beyond pain, beyond the back. Call it NeuroMuscular Movement Therapy and watch how this treatment helped her flexibility and many others too. And you know, Kermit the Frog says it's not easy being green. Dr. Robert Atkins says it's not only easy, it is healthy. He'll talk about super green foods that we all need to eat. Stick around with us for the next hour of Alive and Wellness. Sort of turning into a theme show today since we're talking about managing discomfort and chronic pain. This next subject could also interest you. Maybe you have a problem that could benefit from something called neuromuscular movement therapy. What is this? Well, we hear that it can teach you to move with the agility of a cat, make you exquisitely limber, and lengthen your spine and tone your organs in the process. Now, we wonder how this works. So we welcome registered movement therapist Sara Vogeler. Welcome, Sara.
Thank you.
So there we are learning how, in fact, something in an anger or repressed anger might be bringing on back pain ultimately from Dr. Sarno. This is not an unfamiliar concept even in your work, I suppose.
Oh, no, absolutely. The emotions, in fact, are very much a guide to the body and how you express yourself in movement.
So what is neuromuscular movement therapy in a nutshell?
Neuromuscular, the word neuromuscular I use because it indicates the nerves traveling to the muscles.
Mm-hmm.
So how you think about the way you move is very much a part of who you are. If you're angry, you pull your shoulders in, you're tight, your legs get tight, you may have tension in your neck, you might have back pain, headaches, whatever.
Right.
And your body reacts to that. Neuromuscular indicates that there's a process that occurs between the mind and the muscles.
Uh-huh.
And the movement part of the therapy is that you can do something about it in the way you move.
Now, is this therapy good for a particular kind of ailment person? I know a lot of athletes come to you, certainly,
A lot of athletes, dancers, singers, Wall Street people, anybody that has stress, anybody that has a desire to be better balanced.
And even repetitive stress injuries as well,
repetitive
right?
Stress injuries.
TMJ is one that you work with a lot, too. Say that for me, because I always get it a little mixed up.
Temporal.
Mandibular.
Joint.
Yeah, which is right here on the side of our face.
It's actually right here.
Where we chew.
It's right here. So you can open and close your mouth.
Joint, yeah.
And you'll feel the ball. In fact, I made
feel this.
some...
We brought something to demonstrate this, too, because this is the kind of thing that neuromuscular movement therapy can work with.
We lost the top of my head.
Whoops. Shall I hold it for you?
But you can hold it. This is the temporomandibular jaw, the joint here.
Right.
And if I use the Play-Doh, this will be the ball here, and this will be the disc, because there's a disc. And you can't really see it on the model, but this disc sometimes gets squeezed.
Right.
And that's what causes pain in a lot of people. So you have, I'll turn it this way. You have the top bone. The orange is this top bone.
Right.
And the disc is the green. And here we have the bottom bone. And there's a muscle that pulls this disc forward. And sometimes that muscle gets tight and it pulls this disc out of sequence with the movement.
And that's temporomandibular joint pain
syndrome.
Really.
Right.
Now, how does your therapy work to loosen, I suppose, huh?
Well,
joint to put it back into place?
You want to put it back into place. You want to make contact with the person. Again, having someone feel safe during a treatment session does wonders emotionally. So you're dealing with feelings as well. But you relax the muscles, you work with the trigger points that are there, and you see what's the action of the joint biomechanically. Is it moving forward? You know, the joint actually has two actions. It's a hinge joint, so it hinges open first, and then it glides forward second.
But are we talking about muscular exercises then, in addition to acknowledging what's going on?
Well, we want to repattern the movement.
How do you do that?
Well, we have to see what the action is of the jaw. Is the person opening the jaw first and then allowing it to glide forward? Or is the person trying to glide it forward without opening?
Could you show what you would watch for in me with TMJ if I was suffering from that?
So I put my fingers on the ball,
Okay.
on the jaw joint, and I'd have you slowly open your mouth.
As I normally would, huh?
As you normally would. And so we see right away that your jaw jumps to the left when you open it, and slowly close. Okay, slowly open again. Okay, that was a little different. Now I can feel that it pops out over here on the left side and then slowly close. So, what did you feel?
Well, pleasant. It was nice looking at you there. I could feel just, when you said it was popping over there, I could feel that a little. I don't think I have this problem, but, you know, if it were acute, for example, if it was a real chronic problem.
Right. You can feel, you can actually do it if you put your fingers on that right in front of the hole in your ear. You can actually feel the bone, and as you slowly open, you may notice, oh, my jaw pulls to the left.
Seems like I was going to say, I can feel a little, now, but so again.
So ideally, you'd have it open symmetrically, so there wasn't a zigzag in the opening and the closing. And part of the work I do is to repattern the jaw to get you to open and close it properly, so it's in line, the teeth, the front teeth, stay in line with the bottom teeth.
And you can actually do that just through exercises, because this is non-invasive work.
You can do that through exercises, yeah. It helps to have someone looking at you, or to actually look in the mirror and see yourself if your jaw is opening and closing correctly. But the action of the tongue is very important too.
How does that work?
If the tongue is pushing forward against the teeth, when you swallow, where's your tongue?
Never really thought of it. Well, it's on sort of, I don't think it's pushing that much.
Okay, well the tongue...
Can you tell by looking?
The tongue, it goes a little bit forward.
Does it?
The tongue needs to touch the roof of the mouth about
when you swallow?
When you swallow, every single time you swallow.
Try that. I never...
And when the tongue does that, the jaw muscles, the face muscles can be in balance.
They're more aligned
to each other, right.
Quick lesson in TMJ. Let's talk about some more with our patients over here, because we've got them waiting for us.
All right, here we go.
I think I understand where we're going with this, and we'll see it a little better, I think, with a couple more. This is Melissa, right?
Marissa.
I'm sorry. Hi, Marissa. Hi. And I know Andy, right? Andy's going to join us, too. Now, you two have entirely different problems we're dealing with, right?
Yes, Marissa said that she had a low back problem, and she stands. Would you stand up for us? She was telling me earlier, just a few minutes ago, that her back was bothering her. And if I look at her back, I can see that she has a lot of curvature in the low back, and that would indicate to me that in terms of balance, that the lower back is overcurved. And so with Marissa, one of the things I could give her to do would be to have her come onto her hands and knees on this table. Go ahead.
Do that for us, Marissa? Yeah, okay.
And I would have her gently stretch and breathe and sit back on her heels, and this will actually counteract the overarching of her back. It's not to say that this, this is a brief demonstration.
Right, yeah.
This is one possibility for her, and she said it feels good. Is that right?
Yeah, it stretches out my lower back.
It stretches out your lower back
this part,
here. And I would tell you to do that every day, especially if you're going to be standing all day. And if you can do it twice a day, that's even better. Do it in the morning and at night.
Now, I'm wondering, Sarah, what's different? This reminds me of a yoga pose, for example.
It is a yoga pose.
It is, in fact. So you're working with...
But the body is capable of moving in all three dimensions. You have a forward, a backward dimension, you have a side-to-side dimension, and you have a rotational dimension. And to be really fully balanced, you want to have freedom in all those three dimensions.
That's why you talk about this agility, like a cat, you were telling us before. When you think about how a cat moves, it can become ready for action at a moment's notice, but it's mostly agile.
Exactly.
Supple.
And my job is to help you put every part of your body into that agility. The parts that are designed that way. You have to know how the joints are designed. Not every joint is designed to move in every plane.
And most of us are out of whack with that.
Well,
I mean, most of our joints are not doing what they...
And it's fine, but to have a really totally expressive being, and to be alive, and to be free from stress, and to feel your maximum, to feel your best,
you got to know what they should be doing. Yeah. Sometimes an accident, Andy, unfortunately, you had a bad car accident, did you? What happened?
In September, I got rear-ended by a car that was doing approximately 80.
Andy, sit up here so you face out to the audience.
How badly injured were you?
They diagnosed me with severe whiplash, a severe concussion, and nerve damage on the left side of my body.
Gosh, what have you been doing since then?
I had therapy until June. And I've been seeing the back pain, yeah, the neck pain hasn't really gone away.
Sarah, would he benefit from neuromuscular?
I'm sure he would. Turn your head as far as you can, comfortably. Right. So that's as far as it goes. Yeah. Okay, and then to the right?
The right's even less, because I feel pulling right back here.
Okay, so I would have you lie on your back, and I would do a few minutes on your neck. And maybe bring your knees up so your back is comfortable. And then what I'm feeling for is trigger points in the neck, areas of constriction that are so tight that it's referring pain to other areas in the body. Do you feel some pain that's traveling?
Yeah, it feels kind of like you give me a pressure point.
Right.
Now that brings me to ask, what's different from chiropractic work? This reminds me of that.
Right. I'm not adjusting the bones. I'm working with the soft tissue, because often the soft tissue is the traumatized tissue. The bone can be in line, or it could be that the muscle is tight and it's pulling the bone out of line.
So now you would keep working these pressure points, as you said, with
I keep working the pressure points, and then I'm going to go into the ligaments that are in between the vertebrae. Rest your head down.
Now, ideally, how many times would you have to do this? How many treatments before he might see?
Two times a week for 2.5 hours.
For 2.5 hours? Twice a week for two? And
well, so twice a week, in other words, for half an hour each time.
And how long, though, would you go on with that? Depends on, obviously, till you see some...
Well, you can see that he's a healthy person. I mean, there's a quality of healthiness about him, so I can't imagine it would take more than 2 months.
Should he feel anything now different than he's been feeling when he gets some pressure there?
Wow. What does it feel like?
It feels like when you pull a muscle really bad and someone presses on it right now.
Well, we're going to keep working with Andy. I hope this could be something that could be helped with neuromuscular movement therapy. Again, re-educating us about how our joints should connect to each other and how that can have such an impact on the stress in our lives and how we feel it. We'll keep working with him as we go to a break. Thank you so much, Sarah. Well, she practices here in New York. Thank you. Minute, we just want to thank all our guests today. Terrific show. We want to tell you tomorrow we're going to tell you everything you need to know about DHEA. This is the so-called fountain of youth hormone, and we've been hearing a lot about it, so we'll talk about it tomorrow. Also making your life more sacred, and a Korean movement therapy for arthritis. Now, Sara Vogeler has been working with Andy on his neck problems from whiplash, right? This is neuromuscular movement therapy. Andy, do you feel any difference?
Yeah, I got a lot more out of this than I ever did out of the therapies I was going to for...
That quickly?
Gosh.
Well, not all the therapies combined, but what I'd feel coming out of one therapy session, I felt a lot better when I came out of this.
And you were working on those pressure points, mainly.
On the trigger points and the ligaments. Let's see you turn your head slowly, side to side now.
I go a little bit further this side. When I go this side, it's not as...
more of a range of motion.
It's not quite it's the same, it's about the same on this side.
Maybe it'll help.
But they're going the other way, it's
you all keep
10 times
we'll
better.
Say, see you tomorrow. I'm glad to hear that.